Hi guys, thanks again for coming back again. Okay, it's been a hectic week or two. Lots of pickups from the floor, lots of taking to hospitals and for sort of minor injuries and that sort of thing. Excuse me. One that's really caught in my head was last week sometime. We had a call to a chap who the person said that they thought they was having a seizure. So we got to the gentleman, and he had already had the seizure, and he was on the floor, feeling a bit sort of whacked a little bit, but he generally okay. Excuse me, I can't shake this cold. Anyway, so we did his blood pressure and checked everything else up before we sat him up, and he looked, he said he looked fine, he felt fine. The wife or partner wasn't too convinced. When we got him onto the chair, which he did himself, and this is a big chap, he was 25 plus stone, okay, so I'm glad he could help himself up in the chair. We sort of looked at him and thought, something's not quite right. Can't put a finger on it, but you got this sort of gut feeling, which is not a medical thing, it's just, I don't know, something. And he looked a bit pale, and we asked his partner, did he look right for you? And she said, well, he's a bit more quiet. I thought, okay. So just to be on the safe side, because we don't know why he fitted or seized. Apparently there was no history whatsoever of the seizures, as he's had. And the partner said that when he went down, he looked quite odd. So we didn't really know what that meant, but to her, he obviously wasn't correct, and we needed to get him in. So he walked happily to the ambulance, and we sort of laid him down sat up on a bed, feet up, just because this sort of gut feeling that we were both of us feeling at the time. And just as we just popped the obs on his finger for his oxygen and his pulse, his eyes went to his right and he went down. So what had happened, he was having a seizure. His eyes were pointing to the right side of his brain. Sometimes if that happens, I'm told, it could be that there might be a bleed in the brain. And when people's eyes go in one direction, they go to the direction of where the bleed is. We weren't certain if that was the case. However, he was seizing quite hard. He you imagine this big chappy trying to fight, or his arms going everywhere, and we were trying to not hold him down so much, but to try to not get him hitting us. And so he was seizing for about, 30 to 45 seconds. Then he stopped, and he was very, very placid. Wasn't breathing too well. His O2 levels went down, so we thought, okay, so he's unconscious at that time. Let's have a look at see if we can get an OP in his mouth, because the O2, I can't remember what happened, but I can't remember if we had to try him with the O2 mask and it wasn't working or something. But it was a point where he wasn't breathing. Oh, that was right. His tongue was, he seized again. His tongue went back into his throat. And when it was open, we were trying to get the tongue out the way. And my para said, look, let's get an OP in. His teeth bit down, and we had to yank this thing out. Otherwise, he might break his teeth. So then we tried an NP, which is a nasal tube to go into the nose. And we had difficulty getting it in. However, a paramedic friend who we asked for backup at the time, because he was, again, a big guy, they helped us get an MP in. He seized on us 4 times the back of the ambulance before we moved. And my heart was racing like crazy, because it was my first time that I had a clonic patient. It was the first time that the newly qualified paramedic I was with had a clonic patient, but we just did our training and helped him as best within our abilities. He was fine. he got to hospital and they were doing CT scans or MRIs or whatever it was. The thoughts that the doctors had in there could have been that he could have had a mild tumour, it could have been that he had a bleed, or just that he was having a seizure, epilepsy or something, which hasn't been diagnosed because it's just started, which is very odd for someone who's never had it and had it 4 times at least in the back of an ambulance, and then at least once or twice at home within that same day. But yeah, my tummy was all over the place, and I was really nervous at that. Inside, I thought I was flapping, and my paramedic friend said she felt she was flapping, but outwardly we look fine, so that's good. So you can flap on the inside, but remain calm on the outside, so people think you're okay. That's a very good facade to have. But in seriousness, it's really good to read up on things like this if it's not happened before. Just that if there's anything else you could have done, or why potentially things happened. You know, I mean, his blood sugars was okay. He had a higher blood pressure, but that's because of his size, I think. But there was nothing else to indicate why he was seizing like that. So yeah, so that was my little wobble last week. Anyway, I hope you guys are okay, and try and keep dry. It's been awful weather out there. Yeah, check your cars and make sure that you can brake okay. And I shall catch you later. Take care. Thanks again for watching. Bye bye for now.